Good afternoon, everyone. Welcome to the session titled From Zero to 1 Million Lives, Lafiya's Impact Journey Across 5 Years. To introduce our speaker, Jefferson is the co-founder of Lafiya, a global health nonprofit amplifying women's reproductive rights and providing access to contraception to millions of women living in extreme poverty. For this work, he was honored to be chosen out to be one of the 5 Commonwealth Youth of the Year out of the 2 billion youth. Prior to Lafiya, he was a chemistry researcher at Oxford, a biotech operator, and a founding investor at a 200 million healthcare VC fund. As a short description of the talk, this will be an examination into the cause of family planning in sub-Saharan Africa and Lafiya's approach to scaling its cost-effective intervention to meeting the highest unmet need. As a brief reminder, if you have any questions for Jefferson, you can submit them through the Swapcard app. I'll be selecting a mix of them at the end of the talk, and we'll have a probably short Q&A. And after the talk, there's another event, Office Hours with Jefferson, which you can also access, where we'll have more space for further questions. So without further ado, please join me in welcoming Jefferson Chen to the stage.
Thank you, Alejandro, for that kind introduction. It's a pleasure to be speaking at BA Connect. So let me start with a little introduction. My name is Jefferson, and I'm one of the co-founders of Lafiya. With Lafiya, we get family planning to those who need it and want it, no matter where they live. But for a lot of you, you may see, me, where's my link with Nigeria? How did I end up here? So I want to start everything by telling you a story from around 8 years ago when I first went to Nigeria. I met Fatima when I was 18, and she was the one who put me on the path to start Lafiya. Fatima is a 28-year-old living in rural Nigeria, yet she had already given birth to her seventh child. She was exhausted from giving birth. She was also terrified of enduring just another pregnancy and delivery. Her last birth nearly killed her, leaving her bleeding without any nearby medical support. She knew the next pregnancy could be fatal. And so in 2018, after Fatima had her third child, she wanted to take a break. She had already convinced her husband to try out family planning. She got money from him to take the town motorbike for an hour and to get to the clinic. Yet, when she arrived at the clinic, she found that there were no trained providers. The facility was out of stock of all contraceptive options for the past 4 months. This is the reality for many, many women around the world. The most effective family planning solutions are not reaching the women they were designed for. Indeed, 1 in 4 women in Africa wants contraception but cannot access it. That's 70 million women without a choice. Access to family planning is often a matter of life and death. And in Nigeria, unfortunately, women die from giving life. Every third pregnancy-related death in the world takes place in Nigeria. This is not a statistic. This is a crisis. But there is a solution to the crisis. Here in this image, what you see is Ciana. I'll tell you a bit more. Ciana is a self-injectable contraceptive that lasts 3 months, costs just 85 cents per dose, is discreet to use. A woman wanting to use Ciana can do this in her own time, and it does not require any cold chain. So it was specifically designed for these very remote, low resort settings, exactly like the ones in rural Nigeria that I just spoke of. Yet, though it was introduced more than 10 years ago, it still had not reached those for whom it was created. Why? Well, there are 3 reasons in our investigation. We found out that number 1, Ciana doesn't have an effective supply chain to reach the last mile. When it gets, secondly, to facilities, there aren't enough health providers with adequate levels of knowledge about family planning to then deliver it. And number 3, in the rural communities, such as ones where Fatima lives, women do not know whether this contraceptive is right for their needs. Now, all of this was sort of information that came to me in the years since I first visited Nigeria for a project that was um, unrelated to Lafiya. But, there are these realities that we found out that, often women's lives are dictated by the very circumstance of where they live. And I believe that that's not right. So that's where Lafiya comes in. We built an end-to-end solution that gets Sayana to women who want it and need it with the right product, the right people, and the right approach. And here's how. Step one, the right product. At Lafiya, we import Sayana directly from Pfizer, the only manufacturer in the world, and get it first into Nigeria in the country, and then into rural and last mile communities. We are currently the largest and only implementing organization importing cyanide into the country, matching the scale of the entirety of the federal government of Nigeria. But that's the first step, the right product. It then needs to be provided by the right people. This is where our Lafiya sisters come in. We train and supervise existing community health workers to become Lafiya sisters. They become trusted providers who then deliver family planning care with empathy and, more importantly, discretion. Since Lafiya sisters live and reside in these rural communities, they know how to reach the women who need us most because they have, number three, the right approach. Using our mobile app, Lafiya sisters counsel women in family planning to see which method is right for them. They also provide Sayana free of charge to any woman who wants it, so that ensures everyone can receive high quality care, no matter if she lives in rural Nigeria or compared to where a lot of the viewers you may live, perhaps in a higher income country. So how's everything working for us? Let's start by looking at three main things: reach, impact, and cost. I'm very glad to tell you all that in the 4 years Lafiya has started, more than 400,000 women in communities with little or no access to healthcare at all have chosen Sayana, and almost half of them are using contraception for the very first time. Demand is growing fast. For these 400,000 women, we have distributed more than 700,000 doses already, and by just the end of this year, we're on track to reach around 800,000 doses. And as you can see, the growth is non-linear, and we're very proud to be at this critical juncture of our growth journey. Now, secondly, let's look at what that reach translates into, which is real impact. In Fatima's state, actually, contraceptive was just 2% when we began, and less than 1 year later, it had risen to 56%, a 28-time increase. Why does that matter? Well, because there's very rigorous evidence that shows that meeting contraceptive needs for women everywhere in the world can globally cut maternal deaths by 44%. And we accomplish all of this for just $5 of programmatic cost per year for contraceptive coverage. And it's only half the cost of traditional programs, even though we only reach in the hardest to reach areas in the world. Here you can see a study that we cite from Rethink Priorities. I can urge the audience to please check it out. What that translates into is around 35 to 42x cash transfer as a benchmark. And per life saved is around $2,694. And per dahlia averted is $42. Incredibly cost-effective figures. Now, I'm not alone. There's a fantastic team we have behind the mission, who are sadly not here today. They're actually all arriving in for our team retreat that's happening just this upcoming week. But yeah, we have Clau, myself, Celine, Miranda, and Alex, each taking care of executiveness, strategies, partnerships, raising the support we need, managing the programs, and ensuring that these supply chains that we're building can run. And we're very, very proud to have a host of supporters, many of them from the EA communities, as you'll see here, such as, AIM, such as Effective Spenden, uh, who have catalyzed our work to the point that it is now. Uh, Very much so, we also are very fortunate to have had the support of the Gates Foundation and the Mulago Foundation, and of course, Founders Pledge. There are some of the supporters you may know, and I'd like to take this time to thank them um, for their support. Now, that's only just the beginning. We are partnering now with government institutions to integrate the Lafiya model into Nigeria's national healthcare system so that we can actually bring family planning to the last mile and reach women who have been systematically left out. Not only is the government already taking steps to become the doer at scale by, first of all, leading our trainings and providing supervision to Lafiya sisters, they're also at an inflection point to become the payer at scale. We've recently signed our first, and currently it's actually a bit out of date, and our second, as of just a few days ago, cost sharing agreement with two state governments to see our impact delivered at scale. The dream that we build towards at Lafiya is one where every woman has access to the tools she needs to choose her own future on her own terms in her own time. That's 70 million women who will get their future back with Sayana in her hands. Just imagine what they could do with it. If you're interested in learning more about Lafiya and supporting us, there's a few opportunities for you. First of all, there's the sort of Q&A session and the office hours afterwards. If you think there's anyone who would be of interest to join our advisory board, we're currently very honored to have a former director at the Federal Ministry of Health, one of the leading CEOs at a international and former CEO of international NGO. And of course, you see here Patrick, who co-founded New Incentives that many of you will know about. And we currently also have an opening for an operation manager that's UK based. So the hiring link is just at the bottom there. So there's a lot of opportunities to join and try to support our work. Of course, Giving Tuesday was just earlier in the week. And if there's anything that I can be of help, please feel free to write to me at jeffersonchen@lafianigeria.org. Thank you very much for your time, and I'll pass this on for any questions from the audience.
Oh, thank you so much, Jefferson. That was a wonderful talk. We now have some time for questions. I'll give you guys some time to submit your questions on Swapcard, and in the meantime, I'll have some questions of my own. Yeah, one thing I'm really curious about is how does one go about if you're starting a nonprofit organization in a different country when you were not raised in, how does one go about a rapidly gaining context about a country, a program space? What did that look like for you when you were starting Lafiya?
Yeah, no, that's a great question, Alejandro. I think a lot of times, especially in the EA community, I think there's a lot of these sort of questions. I think the most key thing is to have humility, right? So I've been coming in and out of Nigeria for the past 8 years now, right? And I do not kid when I say that almost every day I'm learning something completely new about this country of more than 220 million. So that is so important. I think a lot of times we have a tendency to think like, look, this is what it says, from the research, so therefore we have to do X. But then you often get there and you find out that the research is around 10 to 15 years out of date and the context is rapidly changing. Unfortunately, Nigeria has recently seen a lot of changes that many of you have seen in the media as well, right? But there's also a lot of very positive direct developments happening too. So I think to have that humility to say, I do not know it all, and I'm going to, approach everything with a learning sort of agenda is very, very helpful. And I think you really need to immerse yourself into the sort of cultural context in which that you work, right? So I'm personally based mostly in Nigeria. So it's most of our, like more than 95% of our entire team. So I think that's very, very helpful to build an organization that really understands what they're, you know, doing. And, still, we're still learning every day.
Nice. I have a question here from Amy, who says, "This is fascinating and amazing work. How do you identify those specific last mile communities who need access? And is there a plan to distribute in other countries?"
Yeah, thank you, Amy, for that question. So for your first part, so how we identify is we do a few things. So number one, we do take into existing sort of data that exists. So we try to triangulate the sort of unmet need. There's quite a few criteria. There's like a whole spreadsheet we do indeed have with this. So like unmet need, safety, existing access to like care, level of stock, all of these factors and we also work very proactively with state governments to also triangulate whether other NGOs are working in the areas that we work, and again, further confirming with government whether these sort of areas make sense. Now, like the first four states that we started working in are amongst the worst in terms of maternal mortality. So there's actually just a lot of work to be done. But yeah, on top of that, we further then triangulate into the very, very specific local government areas and then down to the ward and the communities that we work at. The second part of the question is, sorry, Alejandro, what was the second part of the question?
Sure. Is there a plan to distribute
Uh-huh.
in other countries? Yeah.
Yeah, so of course, our vision, our mission is really universal access to family planning. So very much so. So we started in arguably one of the hardest places in the world. Now we next year have tentative plans to sort of pilot um, to see whether our model works, and we're in the middle of sort of narrowing down that final country that we will start a sort of pilot program in. So we want to approach this very cautiously because we're very cognizant of the fact of like growing too fast too soon. And indeed, within Nigeria, there's still much work to be done. But yeah, hopefully it is the case that, again, via good payers and doers at that scale, we're able to replicate the Lafiya model beyond Nigeria.
Perfect. Another question from Amanda. With this injectable, are they designed through process or physical design to minimize the spread of HIV?
That's it. That would be great, Amanda, if that was the case. So indeed, I think so I have a background in biotechnology. There are certain dual contraceptive HIV drugs that are currently going through clinical trials. I believe they're in sort of phase one, phase two. The cyana itself does not prevent HIV because it's essentially a hormonal contraceptive. So unfortunately, that sort of magic bullet hasn't arrived yet, but we're very optimistic. And once that sort of gets approved, you'll bet that Latvia will be the first one to sort of look at how we can do that.
That's great to hear. Um, Let me see if there's some other question here. Yeah, Elestina, I hope I'm pronouncing your name right, asks, just curious is if there are any spillover effects you're finding with your intervention, and if yes, what do they look like?
Yeah, so we have not explicitly measured for spillover effects, but I think a lot of times, quite anecdotally, you'll find is so for example, in the state where we did our study, because sometimes the level of knowledge of family planning is so low. So the fact of you doing a study will often increase people to use contraception, right? So I think there's a lot of these sort of effects that we sort of observe it's our goal to, with our reach currently, to formalize the sort of monitoring and evaluation system that we have in a much more rigorous way. Not to say we're not doing things in a very rigorous way, but I think it's to really tighten this to examine a host of other sort of questions we're looking at. So very happy to connect you with our M&E team, who are probably much more familiar with these sorts of questions.
Perfect. And I think we have time for maybe one or two more questions. One that I had here. I'm curious if there's like reality is often filled up surprising detail. I'm curious if you have like any anecdotes or stories of like things that a unexpected difficulties of like scaling the program or delivering in the logistics of it, or things that seem easy on their face, but when you actually turn out to implement them, they're like a host of difficulties and challenges to overcome.
Yeah, I think honestly, like if you told us like how difficult it would be to get this program running from the beginning, I think we would not have started it. So every step has been a very big sort of battle, right? Government being slow and inactive at times, the reality of like the big aid environment changing, down to like very sort of when we really first started with Lafiya, the very hands-on approach we had to like message every health worker. There's all of these things at every level, and I think the mindset is always like, okay, well, when we get to stage X, we won't need to worry about these things anymore. And indeed, sometimes it's true, but then you have like things Y and Z that you have to worry about. So I think it's sort of like as you grow, there's sort of pains along each process. You then had to worry about things like you know auditors coming in. You have to worry about like supply chain and logistics. All of these things that we don't necessarily start out having background in, but ultimately it's a very worthwhile thing to be doing. The previous question talked about spillover effect, right? I think the very big consensus in the world with family planning is that it's not only a health intervention, right? This is a tool for economic empowerment. It's a tool for enfranchisement into society. So, these are things that are very real, and we really believe in the mission that we're building upon. And, family planning does underpin a lot of these issues. So, I guess that's why we still have to overcome these things as we go along.
Nice. I think maybe we can cram two more questions that I find here in the chat. But if there is more questions, there will be the office hours after this. From Luz, what is the duration of the Sajana injection? I'm curious to know if you have encountered any challenges with adherence to repeated injections.
Yeah, so the suggested guideline is 13 weeks, around 3 months. There are currently trials being done to see if this works for 4 months because there's a lot of anecdotal evidence that suggests it does. We're not the ones doing the trial. In terms of repeat users, yeah, indeed, I think it is a thing that we are working on, very much so. That's because most of our users actually do not receive any formal education. They don't actually have their own cell phone. So we try to make sure that women who come into our program can get, for example, SMS reminders if they choose to enroll their information, right? But we also try to use some sort of more traditional local methods to try to get retention as well. So for example, there are methods of counting beads for like time, like for it to sort of count time between your injections. Very So one very encouraging thing is we actually worked on the national level on this for the policy making, which is that so the great thing about Cyanopress is that you can take home doses as well because you can inject it yourself. Um, so, but previously, like the Nigerian government was like, no, you have to come back for your reinjection, or you can only take home one dose. So we've been able to advocate for people like Lafiya sisters to be able to give 3 take-home doses. And that had just sort of passed um, early this year, actually. So, we're seeing a lot more sort of uptake of women saying like, okay, that's great because we can just visit a Lafiya sister or Lafiya sister visits us and we can take home 3 doses and that lasts them for an entire year. So we're seeing a lot more of that uptake. And yeah, thankfully, we're able to be part of that sort of policy conversation to push that forward.
Perfect. And last question that I see here. Could you share more on if or how you work with local or even international NGOs and charities that are already operating in the area?
Yeah, of course. So yeah, of course, everything takes a village to do. So for example, a lot of a lot of programs. So a lot of times we get a question of like, oh, what about local attitudes? So state governments and a lot of local radios, so things like Arewa radio in northern Nigeria, they've put out a lot of like house dramas, radios, jingles to sort of promote the use of contraception. And there's also imams as well who are saying like, hey, this is a great thing to do. So there's a lot of demand generation work that we're sort of hopping onto to sort of then say, okay, if you're generating this demand, we're here to fill that sort of unmet need. So a lot of the sensitization work with traditional leaders, with again, state governments, with a host of many INGOs who run these programs, we work quite closely with to try to align sort of our messaging. We have sort of a referral program as well between Lafiya and other NGOs who may carry, for example, IUDs or, for example, um, sort of implants, right? Obviously, the challenge there is these NGOs may not necessarily have stock in hand because of this big stock issue that I was talking about. But yeah, so when possible, our Lafiya sisters will work with them to do that as well. We recently just, on my first point, we're just recently signing another partnership with another indigenous NGO, but that has a lot of reach within Nigeria to formalize the sort of demand generation as well. So yeah, there's a lot of partnerships we do sort of behind the scenes to try to make sure that, the women that come to us can indeed be served the best that they can.
Amazing. I think that's all the time that we have for yeah, all that we have time for now. But thank you so much for everyone coming to the session, and thank you so much, Jefferson. This was wonderful. If you want to hear more from Jefferson, there will be office hours right after this. You can find them on Swapcard as a separate event. And yeah, if you want to be there, I'll be pleased to have you join us.
Thank you for moderating, Alejandro. And thank you everyone for coming.